causes of a female infertility. Okay, in this stage you have seen your specialist. Together you're trying to work out what is the cause of your infertility. In order to understand the problems of fertility, you need to understand how normal reproduction works. To help you to understand, I have created a very simple framework which really helps you to get your head around how normal reproduction works and what could be the cause of your infertility. So, like its name suggests, reproduction involves production of a product, which is a sperm on the male side, eggs on the female side, embryos together, and baby later on. So, like any production line, so the reproduction consists of 3 levels. First level is a regulation of production. Second is a production of the actual gametes. Third is a delivery of those gametes, sperm and egg and embryos and even baby, to have a successful pregnancy. So interestingly, a regulation of reproduction both in males and females is governed by pituitary gland. This pituitary gland is based on the base of brain, and mainly it produces 2 hormones to regulate reproduction, both in females and males. These are the same hormones, FSH and LH hormones. So the production of gametes, sperm happens in the testes in males, eggs happens in ovaries in women, and delivery of the sperm is responsibility of the reproductive tract called vas deferens in males, and the delivery of the eggs and embryos is the responsibility of fallopian tubes. So as we said, interestingly, FSH and LH, same hormone produced from pituitary, governs production process. FSH and LH stimulates production of male hormones in males called testosterone and production of sperm, and the same hormone FSH and LH produced from pituitary gland stimulates production of estradiol from follicles and egg. So now we will move on to discuss the cause of infertility in females. So if you have a breakdown in any of these levels of production line, you have a problem of reproduction, which is called infertility. So today we will not be talking about male infertility, we will be focusing on female infertility. Okay, so we start from level 1. So we will be very systematic and try and understand on which level you have a problem which is resulted to your infertility. So in terms of regulation of production line, the pituitary is responsible. Usually the problems here linked to production of FSH and LH hormone or high prolactin levels, which is called prolactinemia. So having low FSH or LH is not very common condition. It's normally genetic condition. It is very rare. And common problem on this level is a severe chronic stress. It can be physical stress, mental stress, or being severely underweight, being severely overweight. These are the common causes of disruption of regulation or production of FSH and LH. Short-term stress doesn't impact your reproduction that much, but chronic long-term stress does. So on the level of production of eggs, usually you have different types of problems. One is linked to the quantity of your eggs and other linked to the quality of your eggs. In terms of quantity of your eggs, you may have oversupply of eggs or undersupply of eggs. So PCOS, for example, is a condition where you have oversupply of eggs. You have very high egg reserve and you have too many follicles at any given time, and these follicles compete and none of them can become dominant and ovulate. So, and you have anovulation in severe PCOS. Also, you have anovulation or irregular periods when you have a very low egg reserve. That's called diminished ovarian reserve. In severe form of that, that's called premature ovarian insufficiency or early menopause. Also, you can have a problem with the production process if you have a poor quality eggs. That's usually linked to your age, and usually if your age is older than 42, 43, you may have a very poor quality eggs. And also it could be genetic or maybe due to medical conditions, especially if you had a chemotherapy and radiotherapy in the past, that can cause severe issues with egg quality. In terms of level 3, delivery of eggs and embryos through fallopian tubes can be disrupted because of tubal blockage or tubal adhesions. Usually this happens due to endometriosis or pelvic infection. Also, in the third level, delivery level, you may have a problem of fertilization. So fertilization happens inside the fallopian tube. You may have a failed fertilization due to male factor, which means due to very poor sperm quality of your partner or due to the poor egg quality. Also, you may have a problem with implantation due to usually endometriosis, adenomyosis, uterine fibroids, uterine polyps, pelvic infection, and uterine septum. So these are the common causes of female infertility. So going systematically, you can try and understand if you have any problem, any of these 3 levels, then you can work out your actual cause for infertility. So looking at these causes, essentially we categorize female infertility into general infertility into these following categories: male factor, anovulation, PCOS, low ovarian reserve, tubal factor, endometriosis, fibroids, and miscarriages. So if we can't fit your infertility into any of these boxes, we simply call it unexplained infertility, which is very common. So you can see that the fertility, normal fertility involves regulation of fertility, production of sperm and eggs to get the embryo, and delivery of sperm and eggs. If you have a disruption in any of these levels, you may have infertility. So I hope this framework helps you to be very systematic about understanding your cause of infertility, which is very important when you go through IVF treatment.